everyone, this is Dr. Ashwini. This week I thought I'll speak about an important hormone in our body called insulin. Now we're going to speak about insulin resistance. This is a condition where due to persistent high glucose in our bloodstream, your body can't keep up with the demand and supply, and the insulin production in our pancreas gets affected. Now insulin is important for the movement for glucose from the bloodstream into the cell for our fuel production and our energy and function of a lot of metabolic process. So how do we develop this insulin resistance? Now, due to years of chronic stress or bad lifestyle, bad diet, lack of exercise, genetic predisposition, lack of sleep, high BMI, all this can bring about predisposing factors that causes someone to develop insulin resistance. Now, patients present to us with a varied symptoms. Some of them come with tiredness or, family history. There might be hormone imbalance, period issues, fertility issues. So there's a lot of areas that insulin plays a role. Or sometimes the doctor may be, ordering this test based on clinical features like when we have darkest discoloration around the neck, axilla, we suspect, okay, this patient might have insulin resistance. Let's check on this. Now, insulin can also come about with a lot of other metabolic problems. You can have high triglyceride, high blood pressure, low HDL. So all this will make your chance of getting insulin resistant higher and will also make doctors become more suspicious, or this patient might be having this situation. So once we identify that, now it's easily identified with fasting blood, but we always need to justify why we're ordering it. So not all the time it may be covered by Medicare. If it's not, yes, it's a private fee separately for the test. And once we identify you have insulin resistant, it actually allows us to quickly incorporate lifestyle measures to reverse this situation if possible. So we'll get you to go on exercises, put you on a low carb, reduce your processed sugar and unhealthy lifestyle, work on your sleep, work on reducing your stress, look at the environmental risk factors that you might be facing, the kind of choices you're making. And once we identify this, we can easily work on your lifestyle to prevent the complication that we are worried. And often the complication, the first one is type 2 diabetic. There are also risk of heart attacks, strokes, certain cancers, memory issues in the long term. So with this, I hope all of us will be able to identify insulin resistance. And if you think you have a risk, contact your doctors. They'll be able to do a test and help you work on lifestyle measures so that it does not become a chronic condition and lead to all the complications that we're often afraid of. Thank you. I'll see you next week in another video. See ya.